Thank you all so much for joining us today. My name is Allie Farley, and I'm a dietitian that works with Massey Cancer Center. Our talk today is on nutrition and cancer treatment, making the most of every bite. As you entered into our presentation, we turned off your microphones and as well as your cameras, just because we are recording this presentation, so you will be able to view it or share it with family and friends at a later time if you'd like to. As I mentioned, my name is Allie Farley, and I'm a dietitian working with VCU Health System and Massey Cancer Center within the Integrative Health Program. I've been working with Massey for just over 2 years and providing outreach nutrition, working with our Integrative Health Program closely at Massey Cancer Center. So our objectives for today are to discuss possible outcomes of poor nutrition and recognize possible benefits of nutrition intervention during cancer treatment. Review common nutrition impact symptoms and management, such as nausea and vomiting, diarrhea and constipation, fatigue, mouth changes, taste alterations, poor or loss of appetite, as well as address ways to be proactive before cancer treatment, acknowledge the importance of caregivers, and identify who to talk to in regards to management of nutrition-related side effects. When you're undergoing cancer treatments, eating your appropriate nutrient needs and maintaining an adequate nutritional status may be difficult. So you want to be aware of those nutrition-related side effects and how to manage them during cancer treatment. I want to also quickly note, not everyone has nutrition-related complications that arise during cancer treatment. It sometimes depends on the type of cancer you have, where it is in your body, what kind of treatment you have, how long your treatment lasts, and the doses of treatments you receive. Our talk today is going to concentrate on those who do have nutrition-related concerns that arise. So some possible outcomes of poor nutrition during cancer treatment are weight loss, muscle weakness, low energy, easily fatigued, and delayed healing. Preventing and treating malnutrition in the oncology population is important for best treatment outcomes and optimal quality of life. According to the Academy of Nutrition and Dietetics within the Evidence Analysis Library, poor nutrition status is associated with higher rates of hospital admissions or readmissions, increased length of hospital stay, lower quality of life, and mortality in adult oncology patients. The Evidence Analysis Library also found poor nutrition status associated with decreased tolerance of chemotherapy and radiation treatment, meaning patients had worse side effects and were more likely to have to skip or delay a treatment. Nutrition interventions may help patients adhere to their prescribed cancer treatment regimens, which is imperative for optimal outcomes, including remission. Keep in mind, not all oncology patients struggle with unintentional weight loss. Some oncology patients, for example, perhaps early stage breast cancer or prostate cancer patients, gain weight during treatment, which has also shown negative side effects. Individuals who may be at risk for weight gain during treatment should be encouraged a healthful lifestyle with a diet full of plant-based nutrients, have an awareness of portion control, concentrate on hydration, and if possible, incorporate physical activity. The first nutrition impact symptom we will review today is nausea and vomiting. Nausea occurs when you feel queasy or sick to your stomach, and it may be followed with vomiting, but not always. Nausea and vomiting can have a significant impact on nutrition intake. Nausea may appear right after a treatment or up to multiple days later. Patients can work with their medical team to use anti-nausea medications as needed. The timing of these types of medication is as important as the medication itself for improving food intake. So why does nausea and vomiting happen? Well, it may happen due to side effects of surgery, chemotherapy, or radiation therapy, or due to certain types of cancer or other illnesses. Management of nausea and vomiting isn't always easy, but there are a few tips I can offer. Eat 5 to 6 small meals per day. You may find it easier to eat smaller amounts more often, but also try not to skip meals. Sometimes having an empty stomach may make nausea worse. Every small bite counts. Limit exposure to food smells by avoiding food prep areas. Try eating Cool or room temperature foods with little odor. Avoid greasy, high fat foods, as well as very sweet or spicy foods. Consume only a small amount of fluids with meals, but rather in between your meals, drink your fluids. You may feel full faster or bloated if you drink and eat at the same time. Try to drink liquids slowly throughout the day. Some may find it helpful to drink through a straw or out of even a water bottle. Avoid strong smelling lotions, soaps, perfumes, and air fresheners. Rest with your head elevated for 30 minutes after eating, and take nausea medicine if prescribed by your care team. It may be beneficial to try sucking on a hard candy like a lemon drop or a ginger chew for nausea relief. If vomiting occurs, drink clear liquids as often as possible to prevent dehydration and keep your mouth clean. Rinse or refresh your mouth often. If you can incorporate a sports drink or Pedialyte, or perhaps even a clear high-calorie protein medical supplement like Ensure Clear, this will help with meeting your nutrient needs. It may additionally be helpful to keep a record of foods and smells that you didn't tolerate. Some food choices for times of intense nausea and vomiting may be helpful. So for example, clear high-calorie protein medical supplements, like I mentioned just before, some foods like cottage cheese or fruit, cold sandwiches and cheese and crackers, maybe some grain foods like dry toast, saltines, rice, or pretzels, fruits and vegetables like apples, cranberry, or grape juice. Try some beverages like ginger ale, sports drinks, or Pedialyte, something light like a dessert from popsicles or fruit ices, sherbets, or even flavored gelatin. The food choices in this list are very limited and will not provide the calories and protein and other nutrients you need over a long time. Therefore, you should really let your healthcare team know if you are experiencing any nausea or vomiting. The next impact symptom we'll review is diarrhea. Diarrhea occurs when you have frequent bowel movements that may be soft, loose, or watery. Foods and liquids pass through the bowel so quickly that your body cannot absorb enough nutrition and water from them, which can then lead to dehydration and or weight loss. Diarrhea can be caused by cancer treatments such as radiation therapy to the abdomen or pelvis, as well as chemotherapy. These treatments cause diarrhea because they can harm healthy cells in the lining of your large and small bowel. Diarrhea can also be caused by infections, medicine used to treat constipation, or even antibiotics. Some tips to help manage diarrhea are very similar to nausea and vomiting. Again, consume small, frequent meals and snacks. Drink plenty of fluids to replace those you lose from diarrhea. This may include, again, drinks like your clear, high-calorie protein supplements, sports drinks, or Pedialyte. Consume small portions of foods and beverages that provide sodium and potassium. These are two minerals that your body loses when you have diarrhea. Choose foods like broths, soups, fruit juices, sports drinks, crackers, pretzels, or even ripe bananas. Eat foods that have pectin in them, like applesauce or bananas, to firm up your bowel movements. Avoid high fat, greasy, fried foods, and even spicy or really sweet foods. Limit food and beverages that may cause gas, even carbonated beverages, while also limiting high insoluble fiber foods like bran, popcorn, whole grains, dried beans, cabbage, broccoli, or Brussels sprouts. Avoid sorbitol and other sugar alcohol containing products. Some chewing gum or candies are made with these types of sugars, as well as dried foods and processed foods that are marketed as diet or light. Check the nutrition labels. Our next nutrition impact symptom for review is constipation. Constipation occurs when the bowel movements become less frequent and stools become hard, dry, or difficult to pass. You may have painful bowel movements, feel bloated, or have nausea. Constipation may happen due to chemotherapy, the location of cancer, or due to medications. It could also happen if you don't drink enough liquids, eat enough fiber, or have limited activity. When it comes to management for constipation, try drinking plenty of liquids, at least 8 to 12 cups of liquids each day, with each serving equaling at least 8 ounces. Talk to your care team about how much fluid you need. Some types of treatment require an increase in hydration. Also, keep in mind, drinking hot liquids can sometimes help relieve constipation. So perhaps coffee, tea, or soup. Eat high fiber foods that may include whole grain bread, cereals, dried fruits, and cooked or dried beans or peas. Be active if possible. Consult with your provider about what type of activity or movement is best for you. Next is fatigue. Fatigue is a common side effect for many undergoing cancer treatment, and there are many possible causes, including anemia, inadequate energy and or protein intake, weight loss, pain medications, dehydration, and even lack of sleep. Some management tips may be using easy to prepare meals and snacks, already prepared foods, and energy dense foods. Keep non-perishable snacks at bedside. Consume soft, easy to chew foods. Chewing some foods can be exhausting and use up energy. Eat small, frequent meals. Eat well when your appetite is best, and talk to your medical team to determine if you are able to participate in some light activity to maintain muscle mass. Next is mouth changes. This can range from dry mouth, or sore throat, leading to complications with chewing and swallowing. So let's start with dry mouth. Dry mouth is a common side effect of radiation therapy, some types of chemotherapy, and some medicines. Radiation therapy to the mouth area can decrease the amount of saliva your body produces or make the saliva thick or even stringy. Some people can relieve mild dry mouth by sipping on fluids. Others may have more severe dry mouth and experience problems with eating, talking, and sleeping. Dry mouth also raises your risk for dental cavities and mouth infections. Some management for dry mouth might be sip on fluids throughout the day, yet limit drinks with caffeine and alcoholic beverages because they can cause dry mouth. Eat soft, bland foods that are room temperature or cold, such as blenderized fruits and vegetables, well-cooked tender beef, chicken, or fish, and moist cereals. Moisten foods in broth soups, sauces, and even gravies. To increase saliva, you could try consuming some sweet or tart foods or drinks, such as lemonade or cranberry juice. Although, as I will mention here in a moment, you want to avoid acidic foods and drinks if you have a sore or tender mouth. Enjoy soothing frozen fruits or fruit pops, sorbets, or other cold foods. I paired sore mouth and sore throat together because management is very similar. Radiation therapy to the head and neck and chemotherapy can cause mouth sores, like little cuts or ulcers in your mouth, as well as tender gums. Dental problems or mouth infections, such as thrush, can also make your mouth sore. Cancer treatments can additionally harm fast-growing cells, such as those in the lining of your throat. Heartburn and gastric reflux, however, can also cause sore throat. For management, easy to chew and swallow foods and cold or room temperature foods may be helpful. Hot foods may cause more irritation and cold foods may be soothing. Cook foods until they are soft and tender. Puree or liquefy foods in a blender. Moisten foods, again, with broth, soup, sauces, or gravies. Avoid acidic or citrus vegetables, fruits, and juices, as well as pickled or vinegary foods, spicy and salty foods. Seasonings, even like pepper, can irritate sore mouth and throat, as well as raw vegetables and sharp and crunchy foods. If sore mouth or throat arises, avoid tobacco and rinse your mouth often, yet don't use mouthwashes that contain alcohol. So eat foods that are bland, semi-solid, or soft. For example, cream soups, cheeses, mashed potatoes, yogurt, eggs, custards, puddings, cooked cereals, Ice cream, casseroles, gravies, shakes, and smoothies are all great choices and provide the increased calories and protein that you may need. Make smoothies with soothing fruits such as melons, bananas, and peaches. Add full-fat yogurt, frozen yogurt, milk, and ice cream for extra calories and protein. Cancer and cancer treatment can cause changes in your senses of taste and smell. How foods taste and smell can change from day to day, and these changes may affect your appetite. Food may have less taste, or certain foods may be bitter or taste like metal. For some management of taste alterations, choose foods with tart flavors, although, again, be cautious and avoid the acidic foods if you have a sore mouth or throat. Blend fruit into shakes, ice cream, or yogurt. Add some sweeteners. Season foods with herbs and spices. Marinate your foods. Choose room temperature foods with less smells. Try using plastic utensils or a lid over your cup so you don't smell what you're eating or drinking. And finally, appetite. This may fluctuate throughout treatment. Loss of appetite or the desire to eat is a common side effect of cancer and its treatment. Loss of appetite may happen due to sadness, depression, grief, or anxiety, illness or medical conditions, cancer and cancer treatments such as chemotherapy and radiation, and as well as certain medications. It's important to try to overcome poor appetite as best as you can, since not eating can quickly lead to weight loss, weakness, and fatigue. In regards to management, when I talk about poor appetite, I always encourage individuals to first discuss the medications you take with your doctor. For example, some medications for constipation, nausea, or pain can actually cause poor appetite. It may be possible to improve your appetite by changing the type of medication you take, the dose, or the medication schedule. Ask your doctor if a medication to increase your appetite could be right for you. As I've mentioned several times, consume small, frequent meals. Choose food and beverages that are nourishing, if needed, high in calories and high in protein. For example, full-fat dairy, using olive oil, nut butters, extra cheese, or sour cream. Make every bite count by choosing nutrient-dense foods. Move around when possible. Walking and other gentle forms of exercise actually help encourage a better appetite. Discuss high calorie, protein, medical nutritional supplement options with your care team. Try keeping a list of your favorite recipes and meals on hand for friends and family members who help with cooking or shopping. Keep your pantry and freezer well stocked with foods that make quick and easy meals and snacks. And most importantly, eat when you have an appetite. If nutrition impact symptoms do arise, it is better to be prepared, so be proactive before cancer treatment. Stock up on food items that may need little preparation, and make sure to include items you can eat even when you feel sick, as well as nutrient dense with high calories and protein. Meal plan. Cook some food items ahead and freeze them for a later date. Date and label your frozen dishes. Most frozen meals last about 2 to 3 months in a sealed freezer safe container. Don't be afraid to ask for help. Ask friends and family to help with meal prep and shopping. Acknowledge the importance of food safety. Some cancer treatments can make you more likely to get infections. You will want to handle and prepare food with a little extra caution. So for example, keep food at the appropriate temperature, hot foods hot and cold foods cold. Don't leave leftovers out for long periods of time. At some point during your treatment, it may be best to stay away from fresh produce. Wash the outside surface of your produce and cook to remove any residue that may make you sick. Wash your hands, knives, and countertops before and after you prepare food. Thaw meat in the refrigerator or defrost it in the microwave. Cook meats thoroughly, no raw meat or uncooked eggs. Also, read expiration dates. Don't eat food or beverages that have expired. With that being said, do not eat foods that show any signs of mold. Prioritize your health and weight prior to treatment. Finally, talk to your medical team about what to possibly expect. Caregivers are amazing and play such an important role in your loved one's life during cancer treatment. Don't be surprised or upset if your loved one's nutritional signs and symptoms change from day to day. Having food easily accessible allows your loved one to have a snack when he or she is ready. Offering gentle support, which isn't always easy, can be more helpful than pushing your loved one to eat. Work together as best as you can. Make meeting nutrition goals a team effort. If nutrition impact symptoms arise, talk to your medical team. Ask for referrals to other allied health members. Discuss your fears and worries. Feelings can affect your nutrition during cancer treatment. Ask about complementary programs like the integrative health program we offer here at Massey Cancer Center. So in review, preventing and treating malnutrition in the oncology population is important for best treatment outcomes and optimal quality of life. Nutrition intervention before, during, and after cancer treatment may possibly improve adherence to treatment and overall outcome, including remission. Some common nutrition impact symptoms that may arise during cancer treatment are nausea and vomiting, diarrhea and constipation, fatigue, mouth changes, taste alterations, poor or loss of appetite. You can be proactive in regards to nutrition prior to starting cancer treatment. Patients and their caregivers can work together to help meet nutrition-related goals. And if nutrition impact symptoms arise, talk to your medical team. And I just have some references here for you. And I'm going to leave it up to some questions. I see one question already posted, but I also want to note that I have my email on here, and that link below my email is actually the blog or resource that I have through Massey Cancer Center's website. So feel free to access that resource as well for any nutrition-related questions or concerns. So the first question I see here in the chat box is, you referred to nutrient-rich foods frequently. Can you repeat some examples of what they are? So when we're talking about nutrient-rich or nutrient-dense foods, these are going to be foods that provide you enough calories and, or in other words, energy and protein that you need during this time when you might not be eating as much. So these are going to be foods, like I mentioned, your full-fat dairy, or perhaps your nut butters, or this is where you can add your olive oil and get some healthy fats and calories. This is also where we can incorporate, if you're not having problems with diarrhea, but more of your fiber-rich foods like your beans. So try to incorporate those high calorie protein foods when needed, when your appetite is low or where you're not able to consume a lot of different foods.
Hi, Allie. This is Susan. Can you hear me?
Yes, I can.
You mentioned that you should probably avoid raw eggs.
Yes.
But what about in smoothies or blender recipes?
Yeah, I still would encourage not consuming raw eggs, even like a runny egg. You want to cook your foods. You don't want to have your foods undercooked. So cook your eggs, cook your meat, cook your chicken, cook your fish. No raw sushi or anything like that, just because of the concerns of getting sick. That's a great question.
That's a great explanation too. Thanks.
Do we have any other questions? Or maybe just some open discussion for anyone that's participating with us today?
Allie, it occurs to me, oh, here we have another question.
Okay.
When dealing with the fatigue, is it good to get exercise, or will that just waste the little amount of energy you have? What a great question.
Yeah, so that's a wonderful question. And I think it's one of those battles that you have to go back and forth with. Definitely talk to your care team provider about what kind of exercise you can get. Typically, exercise actually can improve your energy level. So if it's possible, it's encouraged to do some very, very light exercise. However, if you find that this just exhausts you even more, I think waiting until you're feeling a little bit better, able to consume a little bit more calories and protein so it can provide you more energy is probably the safest thing. Talk to your care provider and see what's best for you.
And Allie, you're right. As counterintuitive as it may seem, when you're so extremely fatigued, and the last thing that you might want to do is to get some exercise.
Right.
Even small bits of exercise, like going outdoors, walking down the sidewalk, or maybe to the mailbox, just little tiny pieces of exercise. It could be that you've been sitting or in your reclining chair or in bed for 30 minutes just to get up and make a loop around the inside of the house.
Yeah, those are wonderful examples, Susan.
Those activities add up, and the more you find yourself doing, generally it will counterbalance that fatigue. And I think a big thing to consider is to keep the exercise in balance.
Mm-hmm. Absolutely.
Great question, though, and so important. How about anyone else? Allie, it occurred to me as you were speaking, these strategies and these challenges could really apply to most any illness or disease process.
Absolutely. Absolutely. I feel like a lot of these nutrition-related signs and symptoms do arise with a lot of different disease states, not just during cancer treatment. So yeah, this is definitely information that can be shared even outside of the cancer patient population and practice in different types of disease states.
Do we have any other questions? Now is a good time to tap into a very knowledgeable resource. If you have questions about diet or recipes, and I will also add that be on the lookout. Allie is going to present something about holiday eating and foods for the holidays. We hope to have that ready in early December, right?
Yeah, absolutely. And there's a lot of different resources out there in regards to recipes. One that I like to encourage when we're talking about signs and symptoms related to cancer treatment is it's actually an app, but it's also an online resource. It's Dana-Farber Cancer Center. They have an app that provides recipes that are specific to your sign or symptom. So you can go onto the app and say that you're having nausea, and they'll give you some recipes that might help when you're nauseous, or you might be having diarrhea or constipation, and they'll provide you with some recipes, even sore throat. So it's a wonderful resource that I encourage to patients, family members, and caregivers.
So is that app listed on your reference sheet? A reference slide?
I don't believe it is, but you know what? I can probably pull it up here and maybe I can put it in the chat box. Would that be helpful?
That would be great. And then also, if you wanted to add it, we will be posting this talk on the Massey website in a week or so. And so if you would like to review it or look up any of those resources that Allie has listed for you, that will be your opportunity.
Just a moment, I am searching for it now for everybody. Here we go. There you go. So it's a wonderful library resource with a bunch of different recipes. And then I'm sorry, if anyone else has any questions about a specific sign or symptom that arises, I also have a lot of educational resources. We have a wonderful book in our resource library here at Massey that's titled Eating Hints Before, During, and After Cancer Treatment. It's actually available online as well as a PDF. And if anyone is interested in that PDF, I'd be happy to share that with you too. But it walks you through before, during, and after cancer treatment and all the signs and symptoms we talked about today, and even provides some recipes as well.
Great.
And that resource is from the National Cancer Institute.
Allie, thank you so much for sharing this information. And if anyone has any questions after we close, I think you see Allie's email there. We really appreciate you taking the time to tune in today, and Allie, for what you put into this presentation.
Thank you so much for having me.
All right, everyone, I'm going to close things out. Thank you again for attending.